Can you tell me the guidelines on how you protect yourself from getting COVID-19? I've always followed the CDC recommendations such as wearing masks, washing my hands regularly, and maintaining social distance. Coronavirus is particularly dangerous for elderly people, so we need to wear masks, social distance, and stay home. Looking back to January 2020, some people wore masks, while others didn't. At the onset, I didn't think anything of COVID-19, and I really didn't start wearing masks until April 2020, when the government mandated everyone to start wearing masks and stay home. I didn't realize COVID-19 was that serious, but I started wearing masks, which was a new experience for me. Since it is very contagious, we had to wear masks to minimize the spread. Of course, I would wear a mask and maintain a 6-foot social distance from others, and I had to use common sense, not make any trips outside, unless we're grocery shopping or visiting friends who had already tested negative for COVID. I followed the guidelines from the Center for Disease Control and the World Health Organization, such as wearing masks, social distancing, and washing my hands. Unless I had to go out for an essential trip, I would stay home. Even if I have to go out, I'll wear a mask. Last year, I didn't expect we would have a global pandemic. Once the government officially announced coronavirus, they required everyone to start wearing masks to reduce the spread. I was still skeptical of it until I noticed other people starting to wear masks. I saw that the various news outlets were really emphasizing the importance of wearing masks. Whenever I arrived home after being out, I would wash my hands thoroughly for 30 seconds. I would also wear 2 masks, maintain social distancing from others to protect myself. I'd even take a shower after arriving home. To enforce social distancing, many stores actually had a limit on how many people could be in the store at the same time. I would go into the store quickly just to get what I needed and then leave. Anytime I go out, I'll wear a mask, of course, and I'll wash my hands thoroughly or sanitize my hands frequently. That's related to going out somewhere. As far as socializing, there's a select group of people that I will hang out with. In my experience, when the outbreak started initially, I would stay home and really not go out much. I'd only go out for food shopping, and that's about it. Describe your experience about COVID-19 in general. When COVID started, I would read the CDC recommendations, which initially said that masks were not required, so I was confused. My dad said we should follow the China Department of Health guidelines instead. They actually mandated mask wearing. So then I was really confused by what was recommended here in the US as opposed to in China. But now the CDC recommends that we do wear masks. That was a strange time and a different experience for me. Before the COVID pandemic, we were free to go out and socialize at our own will. But after COVID, we were restricted. I had to stay home and couldn't go out. I felt scared about what would happen if I got COVID. I was concerned for myself and other people. I was concerned for elderly individuals and their health. And I made sure to be responsible and protect myself. Whenever I needed to go out, I would wear a mask and maintain social distance from other people. I maintained visual awareness of my surroundings to maintain that distance from others. While shopping, I made sure not to touch my face with my hands, which might be contaminated. After coming back home, I'd always wash my hands thoroughly before eating anything. Going to the store was a different experience. I noticed signs posted saying that if you didn't have a mask on, you were not allowed to enter the store. That was a new experience. There were also limitations on how many people could be in the store at one time. If it was at full capacity, you'd have to wait outside until people exited and a security guard allowed you in. That was new. Before COVID, you could enter any store easily at your will without any limitations or rules. After COVID, communication was also challenging since everyone was wearing masks. I'd resort to writing back and forth on paper or texting on the phone or gesturing. Traveling and being in the airport was challenging as well. Before traveling, I had to fill out a form and set up an appointment upon arrival to my home country, informing them of my duration of stay. That was a complicated process, and they mandated a negative COVID test before embarking. Overall, it was a new experience. At the time, the government mandated wearing masks, so I would wear one all the time, no matter what, just to be safe. When I got back home to the apartment, of course, I would take my mask off. Anytime I went out to the store, or really for whatever reason, I would wear my mask just to be safe. I'd wear a mask anytime I went out, and I tried to get in the habit of it. Sometimes I'd even wear 2 masks if I was in a highly trafficked area, such as a busy city. I felt much safer wearing a mask, as was suggested. Tell me your experience, how you face the challenges interacting with deaf and hard of hearing individuals while you and they have a mask on. I struggle communicating with others while wearing masks, and I don't mind asking them to speak louder or slower. It's better to stand closer together when wearing masks to understand better. Once masks were mandated, of course it was a challenge to communicate clearly with other deaf and hard of hearing people who were also wearing masks. It was difficult to identify the emotions of the person, such as if they were happy or sad, because the mask covered up some of their expressions. But after a while of seeing the same person consistently, it became easier. In the beginning, I had to clarify with them often, but it became less frequent over time. I didn't want to misunderstand them because the masks made it difficult to see their expressions. Eventually, there were less misunderstandings. I wasn't able to catch their expressions, and there were misunderstandings. I tried to overcome that by focusing on their hands only. Before COVID, it was much easier to communicate clearly because I could see their facial expressions and what they were signing. But when wearing masks, it was a challenge to catch the expressions of those I was talking with. When speaking with a deaf or hard of hearing person, it really depends. If they use full ASL, it's easier to understand. If the person depends on lip reading to communicate, it's more of a challenge, and you really have to focus more on the facial expressions. It depends on the person and their communication preferences. Some people sign without mouthing the words, while others depend heavily on mouthing. But so far it seems fine. In the beginning it was really awkward. I was used to talking freely without the masks, and it took a while to get used to wearing them all the time. Eventually, I did acclimate to wearing them. While wearing masks, you do miss out on the facial expression and grammar. For example, scrunching your nose means yeah or true. I can rely on meaning conveyed in the eyebrows, but a lot is missed when the mask covering the mouth. For example, forming an O shape means, oh, I understand. So you really need to see the full expression to capture everything. If I know the person well, I may be able to understand their subtle expressions more easily. But with the mask on, it's harder because it's almost a ghostly appearance with no expression. Sometimes people are willing to pull their masks down, and it's much easier to understand them. But expressions are an essential part of deaf culture. It depends. If it's a friend or someone I know well, I'm able to catch their facial expressions and signs easily. If I'm talking with someone I recently met or a stranger, it's more difficult to communicate because the masks are a barrier. Conversing in ASL is not just signs on the hands. It involves facial expressions, and that's part of the grammar. In my experience, when people have masks on, I'm not able to see their lip movements as people speak while they sign. I'm not able to see a person's emotions that are expressed when they're signing. It's really tough. For me, it's difficult to understand what they're saying because I'm not able to read their facial expressions, and I can't rely heavily on looking at a person's entire face while talking with them. As a result, it's hard to tell what their emotions are. For me, I don't consider masks to be a barrier. depend on touch to understand emotions and how a person is feeling. We use what is called protactile. This is a hand movement such as scratching on the shoulders, laughter. Since we use protactile, that is one advantage we have. I'm still able to communicate effectively with deaf and hard of hearing people. But of course, they need to know how to use protactile to communicate with me. If they're unaware, then that is a communication barrier. Wearing masks doesn't bother me since I don't depend heavily on facial expressions. It's more challenging now. Before the mask mandate, I would rely on facial expressions and gestures. With masks on, it's harder to communicate, especially if the person doesn't use gestures, such as head nodding or raising the eyebrows. With a blank expression, it's challenging to understand. Tell me your experiences, how you face the challenges interacting with hearing people while you both have masks on. Most people don't know how to communicate with a deaf person. For example, if someone comes up to me asking for directions, I'll point to my ear to indicate that I can't hear them, but they'll still try talking to me with their mask on. Again, I have to indicate that I'm deaf and I don't understand. With a mask on, it muffles your voice. That's an improvement that needs to be made. For example, it's easier to hear someone's voice when they speak through an N95 mask. The mask allows more space and is less constricting to the face. Growing up in Indonesia, most people I conversed with were hearing. I became accustomed to lip reading and using my voice while communicating. I use my voice, the person would respond verbally as well. With the masks now, they're a barrier. So I decided to avoid speaking and they'd be forced to figure out how to speak non-verbally with me, such as texting or writing back and forth. There's even an app that transcribes voice to text in real time. If I'm out shopping or in a public space, I'll use my phone as a means of communications with hearing people, such as texting and notes. It's impossible to read lips with the mask on, since you can't see through them. If the person is hard of hearing and doesn't know how to sign, I have to figure out what to do. It's easier to talk with someone who is deaf because we can both communicate through sign language. It's challenging to talk to a hard of hearing person sometimes because they aren't fluent in ASL always and I'll have to figure out other ways of communicating such as fingerspelling. Depends on the person. If they're hearing and aren't comfortable with gesturing or using reference points, it's easier to communicate. If they depend heavily on verbal communication, of course, that's more of a challenge. At that point, I'll tell them to write back and forth with me. If they don't understand what I mean by writing, I'll try gesturing. If they're not able to respond with signs or gestures, we'll write back and forth. Or I might ask someone else who's around and knows signs to respond. But most of the time we communicate by writing or reference pointing. Wow, great question. That was a challenging experience to overcome communicating with hearing people while wearing masks. I'd always been accustomed to writing back and forth with people before masks, but now it's even more frustrating with masks on. Whenever I meet a hearing person whose mouth is covered and they're speaking to me, I try telling them I can't understand and I'll ask them to pull their mask down. But often they don't understand at first and I have to communicate with them that I'm deaf and it's very frustrating and I try to explain it to them so they understand. Some people do use clear see-through masks. One time I actually met an interpreter wearing a clear mask and it was so awesome. It's much easier to see their facial expressions. I really wish all jobs such as hospitals would require people to wear clear masks. Sometimes when the mouth is covered, I feel frustrated because I can't understand. I wish people would know what I mean when I tell them that I'm deaf and I ask them to pull their mask down. I just wish they'd understand that I can't hear them and I can't see their mouth with the mask on. But it's okay. I know that hearing people are still learning how to communicate with deaf people, and I just hope that in the future it would improve. If there happens to be another pandemic, I hope that the situation would be much better as far as communicating while wearing masks than it is today. When it's noisy, It's so hard to understand what someone's saying and communicate clearly. I use what's called telecoil, a hearing aid connected to my phone, and when I'm talking to someone hearing, that helps to reduce the exterior noisy sounds. Also, if I give the hearing person a microphone, they can clip that onto their shirt collar, which helps me to hear more clearly. Tell me your experience, how you understand ASL and facial expression during social distancing. This has definitely impacted the deafblind community because we communicate through touch. How do we receive information if we're not able to depend on touch? Also, computers are not always accessible to us. Zoom is a visual platform. Not all deafblind individuals can use Zoom. It is incredibly limiting, so we had to be creative in order to circumvent that. On the onset of COVID, we weren't sure what to do. As the pandemic continued, we had to find ways to stay connected with each other. If a deafblind individual isn't able to use Zoom, someone has to transcribe onto Google Docs so that way it is accessible. That's via written communication during the Zoom meeting. So that is one way to do it. It's not always easy. Of course, there are challenges that do come with it, but for now it works. As I said, I depend heavily on touch for communication accessibility. Of course, it's important to have that mutual agreement. We both will wash hands and wear masks so that way we're safe while communicating with each other via touch and protactile. So far, it's been fine. What are some challenges you've encountered lacking communication during COVID-19? From what I've noticed in my personal experience and the deafblind community, social distancing has created a challenge. Of course, people avoid close social contact because of CDC mandates. They'll often say, we must follow the CDC. But the deafblind community now has to explain that we depend on touch to communicate. That requires a lot of re-educating. Those the deafblind community socializes with, we don't get out that much. We're often stuck at home because we don't have our own transportation, and we're not out socializing often. Sometimes I think people don't realize that. Also, social distancing has impacted our accessibility. For example, the provision of service support providers, SSPs, has been significantly reduced. SSPs will often avoid working due to medical and various other reasons. The number of available staff has reduced, resulting in a lack of accessibility and resources for the deafblind community. But now it seems that things are slowly going back to normal, especially as people are getting vaccinated. Which, speaking of vaccinations, that is another accessibility issue that we're facing. Vaccination appointments are booked online. And it's not always easy for deafblind individuals to schedule these appointments because the online system is difficult to navigate. It's really not designed to be deafblind friendly. As a result, we have to depend on someone else to book these appointments for us. That is another barrier I have noticed. What tips or guides can you share to the hearing community about accessible communication during the pandemic? I honestly never thought this would happen. We'd all be wearing masks, and this would be our new normal. It's been an interesting experience. But overall, it has benefited us as we've had to learn how to communicate with hearing people. That's helped to improve our interactions, and they've noticed that we need more accessibility. That provides a better opportunity to share resources between hearing deaf communities. Ultimately, that would benefit us in the future as the world improves with the mask situation. I would suggest for hearing people to be more open-minded and patient with us. If you're hearing and you approach someone who's deaf, don't leave in a hurry. Just be patient with them, and be open trying to communicate. Don't say, oh, sorry, ask someone else. That shows a lack of motivation to even try. Don't be scared. It's better to be more open-minded. There's even some signs that look like mime, so it's not that difficult to understand. For example, the sign for food almost looks like you're putting something in your mouth. It's pretty easy to understand. Just use your eyebrows, raise them for yes, lower them for no. It's simple. And if you think ASL is too difficult to learn, just think about communicating using gestures, or you can even write back and forth on paper or type on your cell phone as a way to communicate. Automated speech-to-text is an available function as well. I saw someone use that once, which is really cool. There's an app that automatically transcribes your speech into text so that deaf and hearing people can communicate more efficiently. It's important to keep an open mind to communicate. If you can't speak, don't get frustrated easily. There's still other ways to communicate. When the news outlets initially announced the COVID pandemic, a lot of the information was not accessible to deaf people, so they missed out on information. Those who have language deprivation couldn't read the captions on the TV and didn't understand without an interpreter. In my country, Nepal, English is not the primary language. I realized that sharing information with the deaf community was so important. Trusted individuals in the deaf community who could read and understand that information would share it with others to make sure there were no misunderstandings or false information being spread. Usually those from deaf agencies or interpreters would be the ones to share that information with the deaf community. For example, the COVID briefings that were done at the United States White House were shown in Nepal. Nepalese interpreters who knew English would interpret that information to the deaf community. It is important to have that accessibility. I would read news about COVID and share that to people in Nepal so they would be aware. Sharing news information within the deaf community was a necessity, both interpreted and in sign language. I do have some tips for the hearing community. Try to use gestures and facial expressions when talking with someone who's deaf. This will help us to understand you better while we're having a conversation. When you're trying to think of solutions, I would suggest including the deaf-blind community, especially asking for their feedback. For example, as I already mentioned about the online vaccination booking process, it's not easy to navigate. If a deaf-blind person is involved in that development, you can ensure that the system is designed to be more accessible for all people and not just a select group of people.